Hello, everybody. This is Mark Lynn, and this is the Emergency Preparedness for RHCs update seminar on October the 17th, 2019. We are recording this session, so if you do have any issues with that, you can please disconnect at this time. Again, my name is Mark Lynn. I'm a CPA from Chattanooga, Tennessee. Here is my contact information if you need to get a hold of me. There's my email address and my cell phone number, so you're more than welcome to call or text at any time. Dani Gilbert is on the line with me as well, and she'll be manning the questions there. So if you have questions as we go through here, you want to type those in, please feel free to do so. At the end of the session, we will have a little bit of time for you guys to ask questions. If you want to raise your hand, we will open up your line and you can ask us that way. Or if you prefer, you can just type it into the questions box and we will answer that when we get a chance. What does healthcare business specialists do? We prepare a lot of independent RHC cost reports. We do program evaluations that are now required every other year versus every year. We do a lot of RHC startups, people brand new to the RHC program, and we work a lot in emergency preparedness for the new startup clinics and sadly, for the clinics that get condition level deficiencies and have to get emergency plan together within 30 days or lose their certification. That's something that happens about once a month around here. So that's not a whole lot of fun. Please do join our Facebook group there. There's about close to 900 members now. There's a great opportunity for you to ask questions in there, and we have a lot of people that will help answer questions. And there's a lot of billing questions in there, and so people are very helpful in giving answers to that. So here's what it's going to look like. If you go on there, you can see where people really like this Facebook page. So it's very helpful to people. If you have access to Facebook, that will be wonderful. We are having some free seminars coming up on October the 30th in Nashville, Tennessee, Somerset, Kentucky on 11/6, and Clanton, Alabama on 1/16/20. You will be able to. We appreciate Azalea Health and ChartSpan. They've made it to where we can do this for free for everybody. We'd always in the past had done that for our clients. Only they could go for free, but now everybody can go for free. So the problem is the space is really limited. So if you want to go, then you can. Then you need to sign up for that because there's a couple locations there that it will not be open very much longer. We'll be sold out in those locations. Dani, I'm seeing a question over here says something about certification. Can you read that to me? Maybe we can take it right now, or.
Can you summarize the process and how it is attained? How do you prepare for certification?
Oh, well, this is the wrong seminar for that. I don't have that much time. If we have a little bit of time at the end, I will do that. But we are going to have a webinar called Preparing for the Certification Survey coming up in November. And so that would definitely be the place to talk about that. We will go into this webinar about preparing for emergency preparedness for the certification piece of that. But
hey, Mark, she was referring to the Certified Rural Health Clinic Professional Certification.
Oh, she's talking about that. About what was the question again? Preparing for it.
Can you summarize the process and how is it attained? How do you prepare for the certification?
Oh, okay. Well, Dani, you got it before I do. Do you want to tell her since you know it better than I do?
You just took it, but
okay then.
It's basically through the NARHC, and it's a course that you can sign up to take. And it's got, I think, 4 different modules. Mark credit me because I took it last year. You took it this year. And it's all online. You study for it, and then you go to the one of the conferences, either the spring or the fall, and you actually sit and take the test. And the test is online, but you take it in a room where it's, I guess you would call proctored. Was that the right word? Where they watch
monitored,
you to make sure
proctored.
you're not
Yes,
cheating.
that's the right way. That's the right way.
And so that's how it works. But you're more than welcome to shoot me an email if you have any other questions about it.
Yeah. Oh, yeah. It is a very good thing to do. Even though I'm old and I've been around RHCs for 30 years, I definitely there's you can't really know everything. So there's pieces there that I didn't know, and the videos are excellent. So I learned a lot from the videos. The test, it's about 115 multiple choice tests or true false. So it's not really that hard if you study, and they give you quizzes ahead of time so that you sort of know what type of questions will be on there. But if you just, and it's relatively cheap. It's like $450, which is not too bad to add some initials behind your name. And you have to continue doing continuing education to keep it as well. But the next session will be in San Antonio. It'll be in March of 2020. That's when you can. That's when you can take it. So okay, and then I see another one in there. Dani, what's the other question before we get going?
Pamela said the sound is cutting out on mine. Is that just me? And I think it is, Pam, because it's coming through good on my computer. Okay, so I think it's your computer.
I'll hold it a little bit closer. That way, maybe that'll help a little bit. But okay, let's move on then. We don't spend too much time talking about other stuff here. But do sign up for these free seminars if you're going to be in the area. They will be very helpful there. And we've got the Alabama Medicaid people just signed on yesterday. In Somerset, Kentucky, we're going to have a lady by the name of Cammie Jones who knows all about billing and Medicaid billing there. In Nashville, we're going to have, Rebecca Jolly, Bill Jolly. It's going to be at the Tennessee Hospital Association. So we'll have a lot of information from a political standpoint there as well. So please come. And there's what the agenda looks like. It'll be from 9 until about 3 to 3:30. So you'll have about 6.5 hours. We will provide lunch for you. Zelia and Chart Span are going to buy us some Mott's lunches, and so that's the schedule for that. With Azalea, we are having a webinar coming up on the 23rd of next week about emerging issues in RHC reimbursement. And we'll talk a lot about telehealth and remote monitoring. And then we have Alan Bragwell from Alabama is going to talk about mental health services as well, and doing that via telehealth as well. So that will be next week. So sign up for that. That can be signed up through Azalea Health as well. Where do you find your slides? If you just go to our ruralhealthclinic.com/emergency preparedness, the slides will be located here. We are recording the session, and as soon as it's over and processed, I will put a link to that. So if you have a need to show this presentation to somebody else in your organization, then you'll have the ability to do that as well. First thing we're going to go into, and if you've been to the omnibus presentation that we did earlier in the week, I apologize. A lot of this stuff is going to be exactly the same as what we did before because it hadn't changed that much in 2 days. But what we're going to do, sort of the process for this webinar, is we're going to go through the changes that for emergency preparedness due to the omnibus burden reduction regulation that came out in September the 30th and is effective November the 29th. So that will be the first thing we'll do. We'll go over those changes, and then we'll sort of back up. We'll do some lessons learned from the 2 years that the state, Quad A, and the compliance team have been surveying RHCs, and tell you some of the mistakes that people are making and things that are driving us crazy. And then I'll go back into the basics, and we'll go into the basics as long as we can. We're going to run out of time before I get through everything because I think I have 120 something slides. So that's going to be, we're not getting through 120 slides, especially the way I ramble on sometimes. So here are the regulations, the omnibus reduction final ruling that came out. The final ruling was dated September the 30th, 2019. If you click in here, you'll be able to go and read those regulations. Typically, what you want to do is just search rural health clinics or RHCs, and you'll go through and you'll go straight to the regulations that affect RHCs because it is a relatively long document. So here are the changes to the emergency preparedness regulations. There's only 4 changes that affect RHCs. The first one is currently you're required to annually review your emergency preparedness program. That will be a biennial review in the future. Biennial, I had to look that up. That means every 2 years. So you want to put it on a tickler file that every 2 years you have to go in there. And what we do is we have a sheet in the front of the manual that we have the medical director sign off, the nurse practitioner or PA sign off, and then the community representative sign off, similar to the annual evaluation, or I guess we will call it program evaluation now, because that's every 2 years as well. So the first thing is you only have to review your emergency preparedness program every 2 years. So that's a good thing. The second item here is you no longer have to document that you reached out to local EMA officials or the healthcare coalition in your particular community. However, you still have to do that. So that's really not much of a burden reduction. It's just you don't have to write it down, but you do have to do that. And you really can't implement an effective emergency preparedness plan without reaching out and touching base with those people anyway. And they are an excellent resource. I know the ones that we've worked with, they've been very good to us. And typically they will set in on us when we do a tabletop session. And when we go through, we have a tornado drill that when you become a new rural health clinic, then you can you have to get one of these drills in before the inspection. So we'll typically do a tabletop tornado drill, and we will invite those EMA officials, and they're very good about setting in on those. And if I say something wrong, or if it's not the way they do it in a particular town, they'll let us know and say, well, here's what we need to do. So they're very good to work with. And then here's the next 2 items on emergency preparedness is the training requirement is currently every year you're supposed to train your all of your staff, and we have like a little 1-page test with 10 questions on it where we give them when you first become in the RHC program, you're required to every year retest them. Now it's every 2 years, so it's biennially. I'll get used to saying that word eventually. Biennially now, so every 2 years you have to test them. But do remember when you're onboarding a new employee is you're going to have to give them that test as well and get contact information from them to add to your communication plan. So remember, your communication plan will be something that's sort of fluid, because you're going to have people come and people go. When your employees leave, you need to take them out of your communication plan. And when people add on, you're going to have to add them to that communication plan, and you're going to have to give them that test as well. And then the testing of the emergency program, typically we used to have to do 2 tests every year. You could do 1 tabletop a year, and you could do one, and you have to do 1 community, or if a community drill wasn't available, you could do a facility specific drill. Now that's down to 1 test per year. And the rule is you can do a community drill 1 year and you can do a tabletop the next year, but you just have to switch them out. You can't do 2 tabletops in a row. You could, if you had, you could do 2 facilities in a row, or you could have had 2 community-wide drills in a row. You could do those, but you can only switch in a tabletop exercise every other year. And if you have questions about these regulations, the people that wrote it, we have their phone numbers on here for you. You can call them, and I've had to call them before, and they're usually very good about responding to these things. So here is just basically we've copied and pasted from the regulations, so you can see where we're getting our information here. And so I won't spend a lot of time repeating this, but here's just, you don't have to document your efforts to talk to your local people there. And it says here, this is in the comments. I always recommend reading the comments very closely, because they're very helpful to help you understand how to comply with these regulations. But it says that you still have to reach out and talk to your EMA or your hospital coalition people. It's just you don't have to document it, which that's sort of silly to me, but that's what they say. Here's again your annual review biennially, so that's that's not rocket science there. Do double check with your states. A lot of states, or I say a lot, I know Louisiana said they just put out a memorandum last week saying, we, it says that the feds say you only have to do it every 2 years, but Louisiana has not changed their rules. So keep that in mind. That's also a trap for you guys, is that in your policy and procedure manual, your emergency preparedness policy procedure manual, it says you're going to review it every year. If you don't go into your policy and procedure manual and change it, when the state inspector or Quad A or the compliance team come in and your policy procedure says you're going to review this and you're going to train people every year, but you're only doing it every 2 years, then you're going to have a deficiency that you're going to have to correct. So watch your states there. Louisiana is probably, I can't think of any other state that would actually do this. Louisiana is very weird. I really don't do any startups in Louisiana because they have such strange rules. I send those over to Patty Harper and say, Patty, there's somebody in Louisiana that wants to be an RHC. You go for it, girl. So just keep that in mind as well. The training requirement, again, every 2 years biennially versus every year you need to train your people. So very, very simple there. The testing requirements, if you're a hospital, they've expanded the types of acceptable drills that they will accept, but you guys will still have to do 2 drills. If you're a hospital, they have not relieved you from doing the two drills. So if inpatient facilities, cause, nursing home, I think there's a listing of people that are still required to do tests. The RHCs are only required to participate in 1 drill for each year. So keep that in mind. But if the inpatient piece of it, you're going to have to do 2 drills. And here's the listing. I knew it was coming up soon. Here is the listing of the types of organizations that are still required to do 2 drills. It's just there's more acceptable types of drills for them than they were in the past. And then this is the regulations for our RHCs. This is talking about the opposite years where we can do 1 community-based drill 1 year, and then the next year we can do the tabletop exercise. So we should have that one down by now. We know what we have to do there. 1 drill a year and just flip the drills. Also, if you're the unfortunate people that have an event or an emergency during the year, those will count as one of your tests of the one test of your plan. So you will not have to do another one. The key to that is to write up an after action report, and we'll have a link to show you a template of an after action report here just in a minute, so you know how to do that. And then how much money is this going to save us? Apparently, it's going to save us about $4 million a year for this, which they have some very strange ways of coming up with those numbers. It's probably about 10 times that as far as the cost of these regulations. So hopefully it's 10 times the savings as well. Be careful though, some things did not change. The all-inclusive risk assessment still must be done annually, and we'll show you what an all-inclusive risk assessment looks like as we go through these slides. Your communication plan, again, I remember I said it's a sort of a fluid document. When people come and people go, you're going to have to put their names in there and take people's names out. That still must be updated annually. So I would sign a signature page on that indicating that you have updated your communication plan each year. So those things have not changed. And that's all of the omnibus changes. There's only 4 of them, very, very simple changes for you guys to keep up with, but a significant relief on some of those regulations. So here is the history of the emergency preparedness rules for rural health clinics. They started out in basically, let's see here, they were actually approved in, I think, November. They actually were approved in September the 16th, 2017. They had to wait 60 days for them to finalize the rules, and that was like November the 16th, 2017. And they gave us a 1-year reprieve to November 2017, when CMS inspectors would actually start writing you up for deficiencies related to emergency preparedness. The penalty for not doing this is they can take away your Medicare certification if you do not meet these regulations. So it's very punitive if you do not comply with these regulations. About 3 or 4 or 5 months before the regulations came into place, CMS finally issued something called Appendix Z, and those are the interpretive guidelines for RA for all 17 provider types. There's 17 different provider types that must comply with these rules. They issued about a 74-page document related to all 17 types. So we sort of had to dig for the stuff that related to RHCs, and so that's what we did, and we got everybody ready for the November 15th, 16th surveys coming forward. In February 2019, CMS did adds to this Appendix Z, and as far as RHCs goes, the biggest thing was infectious diseases, and we'll show you some of the policy that we've developed for you guys for that. Get your hands on that, and then also make sure to include infectious disease in your all hazards risk assessment that you do each year. That will go a long ways in satisfying your RHC inspectors. They're very concerned about about infectious disease here. I'm looking here at the Tennessee Department of Health Southeastern Region Emergency Operations Plan from January 2019. And I don't know if you can see through the camera here, but it's a very thick document that we went over in January 2019 on pandemic influenza response, the novel virus as well. So CMS and the states are very concerned about infectious disease. So we want to make sure we add that to our emergency preparedness policy and procedure manual. So here's your Appendix Z. Here's, if you want to get your hands on the actual document, you can click here, and let's see here, and let's go on to the next page. Here's what the memorandum will look like from February the 1st, 2019, and you can click on here, and this will take you to that particular document. Here is our policy procedure that we came up with for for infectious diseases. You want to print that off, look it over, make sure it's what you guys would be doing, and put that in your policy and procedure manual as well. And then there's some forms that go along with that as well. So you want to click on that and print those off, and then incorporate that or something very similar to that in your emergency preparedness policy and procedure manual. And when you're doing your risk assessment, we use the Kaiser risk assessment tool, and it's misspelled in the. For once, I didn't misspell that one. It's misspelled in the Excel spreadsheet. So I guess I could probably fix it in the Excel spreadsheet. But that's the way it came. But infectious disease outbreak, we moved that up to number 5 as far as the different risk in our area. Okay. Lessons learned. What have we learned over this the last 2 years of dealing with this? I'm gonna have to move this, move that over for right now so I can see what my list says here. Here's some of the things that are going to get you in trouble. Number 1, I was not aware of emergency preparedness rules is not an acceptable response to the inspectors. Every single month, basically, you're going to get a condition level deficiency. When you get a condition level deficiency, you have 30 days to respond, and the state or Quad A or the compliance team, they will come back out and reinspect you to make sure that you've done everything. 30 days is not a long time to put together an emergency preparedness policy procedure manual, do a risk assessment, contact your emergency officials, get a secondary way to communicate with people. Do all the little things that you need to do in order to have an acceptable plan, because when they write you up for every single thing. And it takes a good 30 days. And sure enough, as soon as I get one finished up, somebody else will have another one. I just finished one the other day from Alabama, and I just got a call from California, and one of our clients, they didn't do a thing on emergency preparedness. So we're going to be right in the same boat again. And one of the things that we had somebody do, they got a good condition level deficiency. They printed off. We're very good about offering free stuff, much to the chagrin of a lot of the other consultants out there. But if you want our policy procedure manual, it is on our website, in the Emergency Preparedness website there. You can print it off and you can search and replace and put all the information in there. The problem is, if you do that and you don't bother to even search and replace, put your name in there, you don't put your communication information in there, you don't reach out to your officials and work with them, you don't have a lot of the stuff that's required in there, you're going to get written up for not having a good emergency preparedness policy manual. I think somebody that did it, they called me up and said, well, we failed, we used it, we failed. And then they sent me what they had. I was like, well, you didn't do anything to it. What do you expect? So it's very frustrating sometimes. And then, again, you're going to get condition level deficiencies. It's 30 days. It's not worth the stress of having to deal with that within 30 days. Just go ahead and do things ahead of time and get it fixed. It'll be much better. Sometimes these surveyors too, they'll get on a roll and they'll start writing you up for more. They'll use the hospital or nursing home rules. So if they're asking you to do something that you don't really think that you should have to do, let us know. Sometimes it's just easier to comply. I think the one of them I can remember was they had us to communicate our census to the hospital. So we looked up a form, printed them a form, and said, we're going to tell them how many patients that we have, and they were happy with it. It was easier than arguing with them that we don't really have to do this. According to Appendix Z, it was easier just to deal with it that way. So if you do run into that, let us know. We'll try to help you. We'll help your way through it. Again, if you do not update your emergency plan on a timely basis, it will be a condition level deficiency. What we've been running into is that everybody got everything done by the November 16th, 2017 deadline and then forgot about it. And what happened was, when the surveyors started coming in late 2018 and 2019, all of 2019, you haven't touched that emergency preparedness manual. You are getting written up for not updating your manual. So that we've seen that happen a lot in the last few months. So you need to make sure that you're doing that. The good thing is now you have 2 years to update that. So you're okay as far as timeliness as of right now. Again, these rules go into effect November the 29th. So I'm assuming you're not going to get surveyed between now and the 29th. So cross our fingers there. But it is something you need to remember to update these things as of right now every 2 years. And then your communication plan, we've had a lot of people have issues on those communication plans, not putting in information from contractors, from Healthcare Coalition, EMA officials, and the closest 4 RHCs. A lot of folks are getting written up for not knowing who the closest RHCs are, so they can reach out to them. So, and we're giving you some ways to deal with this. Here is one reason why you don't really want to you don't want to get written up for this. This is Quad a deficiency monitoring plan, where this is an Excel spreadsheet where we have to go and monitor quarterly, annually, monthly, every week. I mean, it seems that way, and we have a program called Asana where these people get an email every quarter or every month or whenever they're required to do something, saying you have to do this, and they have to click in and show that they've done it in their monitoring plan. So you don't want to get this condition level where you have to go through these heavy duty monitoring plans. Remember when I said about the regulations not fitting, one size not fitting all, and that the state was writing us up for things that didn't relate to an RHC. Here's one of the documents that shows that an RHC is not required to communicate to hospitals about occupancy. We're not required to have a generator, and we don't have to have a lot of substance for staff and patients in a rural health clinic. I mean, typically you need to have a place to shelter in place for your RHC, for your patients, but you're only going to keep people there for a couple hours at the most, especially like for a tornado. if you're worried about your people getting stuck in a winter storm, why in the world were you open in the first place? I mean, you really, if it looks like there's a winter storm coming, you need to close well ahead of that time. So you typically don't need a whole lot of substance for that as well. Okay, let's move on now. Here's how your closest RHCs. Here's an example of one that we provided for one of our clients here. What we did was we looked it up on this website here. If you know who they are, that works pretty well. You can just look them up, and this website will actually give you the name and the address. So you can give you the CCN number for the clinic. And if you ever forget when you were actually surveyed as a rural health clinic initially, you can look it up there as well, because I know a lot of times your cost report preparers will ask you, when were you first become a rural health clinic, and you won't know. It is on that website as well. I use that when we're preparing cost reports and people don't know when they're surveyed. I just look it up for them and put it in there. If you don't know who the 4 RHCs are, this is a listing that CMS used to produce. So it's getting a little bit old. I think the last time it was updated was 9/7/2016, but I put that on our website so that you guys can have access to it. So you just got to click on there, and it's broken down by state. So this was actually the first page of the document there, but you can look into your state, and then just by looking at their addresses, their cities that they're in, you can tell who's close to you and who's not. So you can use that. So that way, but just do that one pager there with the phone numbers and addresses for the 4 closest RHCs. And if there's something that happens in your area, then you have that document there where you can call them. I don't know why you would, but that's what the requirement is. So that's what we do. And so we've got people written up for not doing that several times here. So lessons learned. One thing that we have learned is when we're doing these RHC startups, is that we would do the emergency preparedness manual, we'd search and replace, we'd put in a lot of the document in there, but we would have the people fill out the communication plan, just tell them, okay, we'd set up all the tables for them and say, put your communication data in there. What we found out is they wouldn't do it. We'd also have a little table on delegations of duty, and they would not do that. So we got a very long form now that we send out people and have them send it back to us, and then we'll type in all the stuff for you guys. That tends to work a lot better on you guys getting a good, complete emergency plan than us doing 75% of it and saying, okay, you guys do the other 25%. We've had a hard time with the 25%. Here are the citation frequency. Looks like I forget the number on there. There's 4,469 RHCs. I think they surveyed maybe 836 of them or something, some number like that. And this shows the most common deficiencies. A lot of folks here, physical plant and environment. That probably relates to drugs and medications. Expired drugs is probably the number one thing. I didn't look at the J0043 because I was worried about emergency preparedness, but you can see here, this was the first one. Actually, about 7% of the clinics have gotten written up for emergency preparedness training program. And then you can see reviewing annually. Once you get one of these, you're going to get the rest of them as well. Establishment of the emergency program, emergency preparedness testing and training. So, 5 to 6% of you guys are getting deficiencies related to these. And it's not hard, this emergency preparedness stuff, to avoid a deficiency. You just have to pay a little bit of attention to it every year or so, and you should be good. So those are the most common deficiencies. We have updated our policy procedure manual. So remember that policy procedure manual that I told you that you can go online and get it for free. We've included the omnibus burden reduction update in there. So it says biennial when it's supposed to say biennial in there. So you can just click in there and update your policy and procedure manual, or you can print off a new one if you don't have one. It's all there for you. And then here are some other, all the stuff that we've had to do in the recent years or recent months related to emergency preparedness. If you go on our website, you can click in and get all of the documents there related to that as well. The infectious disease policy. There's a transfer form that we were required to do at one clinic, and so those documents are there for you guys. Other resources that are out there. There's a lady called the Recovery Diva, and it looks like she may actually be a little bit older than me. I'm glad to see that there's one person out there still doing this that's older than me in the country, and she is excellent. If you read through her blog, she gives us a lot of great ideas. And there's a bookstore, and then Connect Consulting. If you ever have a chance to listen to their webinars on emergency preparedness, they typically have one about one every month, and they're very good. Obviously they're a lot better than we are at this, because that's all they ever do. This is something that we do specifically for rural health clinics, but those are very good. Okay, test question here. What happened on this date exactly 30 years ago? And since we don't have any polls to open up, I will tell you the answer to that was 30 years ago today was the Great San Francisco earthquake. They call it the World Series earthquake, because I can remember watching the World Series, and next thing you know, everybody started shaking. And so I think 68 people died from that earthquake. And that's one reason why they have the shakeout drill on October the 17th. So the day is the day that if you signed up for the shakeout drill, this is the best day to do it. You're going to have 20 million other people working with you to do a shakeout drill. So if you haven't done it already, as soon as we hang up from this, go on to this shakeout website. And here's the website where you can go to this for what we're showing you here. You can register for your state or for your territory, and then you can do a shakeout drill. And basically, you just have to make sure that you document it with an after action report. An after action report is what you need to prove that you've done an emergency preparedness drill, and you want to put that in your emergency preparedness policy and procedure manual to show evidence. Here's if you're in Tennessee, where we're located there, we're in the central United States. Here's what it will look like when you register for your drill. And then what you can do for your drill is, here's a video that you can, there's two videos here. One's an introductory video. Another video is it's about 4 or 5 minutes long, and it's showing some third and fourth graders from Missouri on how to do the shakeout drill. And then there's about a 1 minute drill. Basically, it makes a sound like it's rumbling, and it'll start saying, "This is a drill, this is a drill." And you're basically going to get under a table. You're going to hang on, you're going to cover your head, and then you're going to hold on to that table for as long as the drill happens. And then you're going to wait a little bit, because things will shake and there may be an aftershock or so. So you want to stay still for a little while. And then at that point, you want to completely evacuate your building. And then once everything has been evacuated and it's safe to go back in, then you're going to write up your after action report and learn and write what you've learned from the process that you've done, and how to improve it the next time that you do it. So here's the listing of the stuff that you have to do in order to get it to count for your CMS full-scale exercise. So that will count as one of your full-scale exercises, not a tabletop. It's a full-scale exercise. So it's probably the easiest way that you can do one of these. So coordinate with the 20 million people that are doing this drill today. And then here is your after action plan. Here's a template that you can use. And we're supposed to have one. I think one of our clients was doing one this morning. They were going to send it to me because they couldn't get the Word file to work, and I was going to type it up for them, which I don't know how I would have had time to do it between now and then. But I was going to show you the after action plan that we typed up for that particular clinic, and it just never did get to me in time. But here is a blank after action plan and template, and you can use that to document that you guys have done this. Okay, let's move on to basics here. We've been going 40 minutes. We'll go about 10 minutes. We'll go to about 2:40 and then save 10 minutes for you guys here. Katrina really got all the CMS officials upset about disaster planning, because they really did not do a whole lot of disaster planning, and we saw what happened in Katrina. So this became a bigger and bigger issue. November 15th, 2017 was the date when these regulations became enforceable to everybody. And again, this is a condition level deficiency. So and these are actually a part of your normal inspection. In Tennessee, we get inspected every 6 years by the state inspectors. So if you haven't had your inspection in the last 6 years and you've been sort of moseying along and not really worrying about emergency preparedness because nobody's come to check on you, well, they're coming to check on you eventually. I mean, with about every 6 years, they will come out, check on you. If you're not doing your emergency preparedness, then you will get written up for that. If you're in other states have different timelines when the state comes out to do their inspections. Or if you're Quad A, I know they come out every 3 years. The compliance team, I think it's every 3 years as well for them. So keep that in mind. Here are the initial regulations there for emergency preparedness if you want to get your hands on those. Again, 17 different provider groups. We're on the list here. Rural health clinics and FQHCs are required. 72,000 different providers are required to comply with these. Again, condition level deficiency. These things are a bear to fix if you're behind the 8 ball and you get inspected. Believe me, they're no fun. Why do we have emergency preparedness? Again, there's systematic gaps in our emergency preparedness system, and they're trying to fill in those gaps by basically recruiting these 17 provider groups to help in times of emergency. So it's basically they're putting together a coordinated emergency response in your particular community. Let's see here. Again, it will be somewhat time consuming and, it'll cost a lot of money. Here is the CMS website that you can go to with a lot of different documents on there related to this. So I definitely recommend you clicking on there and seeing how it's been updated. This slide was done 2 years ago. My goal this morning was to go back on the slide and put a new one up here, but we did not get that far along. But you definitely want to look at that. Also, videos. Videos are fantastic. The CMS produced a lot of great videos on emergency preparedness. So we always recommend watch those YouTube videos. In fact, I watched a couple of them this morning, and you guys aren't watching these videos because they'll have these great videos on emergency preparedness, and they'll have 312 views or something. So a lot of great information out there to help you when you're doing training for your employees. You can stick one of those videos in there for 20, 30 minutes and really help them learn a lot. Here's Appendix Z that came out June the 2nd, 2017. So there you go. There's a 74-page document if you want to get your hands on that. And then here is a document that the surveyors are using for the 17 different provider types. What we did was we edited it down to just the ones that related to RHCs. I think there's about 24 different deficiencies things that they were looking for related to rural health clinics. So you want to take a good look at that document. Here are if the compliance team is your accreditation organization, and Kate Hill did a fantastic job in getting out her standards back in 2017. So here are the standards. Probably want to take a look at, they may have an updated version with the new Omnibus Burden Reduction Act. And then the same thing, did I put Quad A's in there? Where's Quad A? I didn't put Quad A's in there, but Quad A has their emergency preparedness regulations as well. So you want to take a look at those. And then if you really want to get into emergency preparedness for your clinic, there is a surveyor training course that you can go through. It takes about 8 hours to go through. It's very, very helpful to learn about emergency preparedness. I've gone through it, and it's very good for that. Here's what it's going to look like. It has questions there. It has pretty hard questions, actually. Questions are a little bit harder than the RHC professional exam. So if you want to go through, this one, and it's pretty good. Let's see here. Let's go on to the next one. Some of the key terms. They have FAQs related with all that define all the terms, which is very good. So when you go to that survey, where is that? Let's go. I'll back up a little bit here. Where is it? This right here. If you go down below here, you will see FAQs that define all the terminology, and those will be very helpful to you. Let's see here. And then here's what emergency preparedness program is. Number one, you have to have an all hazard risk assessment for emergency planning, development, and implementation of policies and procedures. We do have some really good policy procedures, I think, because we took that Appendix Z and basically just copied and pasted and regurgitated and changed an RHC shall to we will. And so it gives you exactly what you need that you need to do. And you have to have a communication plan and then a plan for training and testing. Testing the plan and training your people is what you have to do. There's the four sort of core components of an emergency preparedness plan. So you just want to take a look at that emergency plan, policy procedures, communication plan, and then training and exercise program. You have to have those four core elements. Risk assessment, remember the risk assessment is still annual. It's not biennial, it's still annual. So you want to get your hands on this Kaiser tool and use it to make an assessment of the types of things that are going to kill you. So that's going to be on our website as well. Also, risk assessments have typically done by there's a risk mitigation plan. If you look up, if you put your county name and risk mitigation plan in Google, you will find a 700-page document about all the things that are going to kill you, when they've killed people, when they've landed, and when tornadoes have come, what year, when the floods have been there. You will have more information about the risk than you'll ever want to know of your particular area. And so basically the process is you'd identify what hazards are out there, what assets that you have that could be affected by it, what the impact would be if something did happen, and then basically ways to curb the destruction or how to have a quicker recovery if something did happen. That's the piece of emergency planning that you have to do. Let's see, I'm on 17. I got 3 minutes here. Well, let's go through some of these slides pretty quickly. Here's that Robert T. Stafford. He's the one who put this Robert T. Stafford disaster relief. This requires local communities and jurisdictions to have a new risk mitigation plan every 5 years. So that will be, get your hands on the risk mitigation plan. That will make it much easier for you. Here's what one looks like that we did. Also, when you're doing your risk mitigation, you have to consider where you are located. And are you close to schools? Are you close to major highways? Is there a big lake there? Is there a nuclear plant close by? You want to look at specific to your facility as well as your community as a whole. So you definitely want to put a Google map in there, and that will be a part of your emergency plan. And here's what this Kaiser plan looks like. You go through what's the probability of something happening, what would be the human impact if it did happen, what would happen to our property, how fast could we get our business back into place, and then how much preparing have we been doing ahead of time? What type of internal response within our organization do we have available, and what sort of external resources within our community do they have in these types of items? So you go through and you sort of put 1, 2, or 3, or a 0 with each one of these, and it will come up with a nice little list. It'll rank these. And so we got 10 items here, and you want to have an emergency plan for about the top 5 items on here. A really good emergency plan for that, and that's your risk assessment. You have to do that every year. The way we do it is we'll do a tabletop, and then we'll ask you. We'll go ahead and fill in the numbers ahead of time, and then we'll ask you, are we stupid or did we get it right? And then we'll fix the risk assessment after the tabletop session is over, and then send you a new one with our after action plan. So we talked about biennially. Let's go through here. We're running out of time, so I won't go through all of these here, but let's see if there's There's stuff at the very end, types of drills. This is what the module looks like for the tabletop too. We have a tornado tabletop. All this stuff comes from FEMA, so you can get your hands on it and use it to run your tabletops. It works beautifully. Let's see here, and we'll go through this here. If you're a hospital system, do remember that each one of these individual, if you have 10 RHCs in your integrated health system, then each one of those have to have an emergency plan that falls on their own. So you'd have to have like those Google Maps of each location. You'd have to do the risk assessment based upon that specific location, and then have a policy and procedure related to that integrated health plan. Let's see here. Information and resources. Here's some other stuff. Here's our website, ruralhealthclinic.com, emergency preparedness. This will have tons of information on there. We basically put everything we have on there for you guys to get your hands on. As per Tracy, if you looked at it 2 years ago, it was not helpful for rural health clinics. It's gotten a lot better. I know I've started using it a lot more because it's gotten more and more information on there. So go to Ask for Tracy, and they will be able to help you with this stuff here. So, and then here's some more templates from CMS that you can go on and get those. And then here's a bunch of links that we've provided for you guys. There's your FEMA tabletop for a winter storm that you guys can do as well. And I won't go through those. Some people do get one of these vinyl guides. This is good if you're a hospital system. Get you this company here provides these vinyl guides, and you can put your emergency plan in there so that people can look at it very quickly and know what to do in case of each type of emergency. The problem with those is that to get a run printed, it's about $2,500. So you have to basically have a hospital with a lot of different locations. But I've seen them in several hospitals that I've gone to, and they're pretty neat. So if you're in a part of a hospital system, that is something that's good. Get started now. If you haven't done anything yet on emergency preparedness, get started. You've gotten some relief from these Omnibus Burden Reduction Act, but don't rely upon that. Because we've seen too many people have a lot of deficiencies related to emergency preparedness over the last year or so. Okay, we've got about 8 more minutes of time here. Of course, we can go over. There's no requirement for us to end on the hour. But if you have questions, if you want us to open up your line, Dani, if you'll help me find some questions in there. If you want to type them in, then that's great as well. Okay, Dan, you want to read me the question? What's that?
Yep, you got one. Just some clarification. The EP policy and procedure template that is on your site is what we should or can use for drafting our emergency preparedness plan. Of course, we would need to change it for our specific practice.
Yes, what I have on there will work. I mean, it is very good. It's been tested many times. It's gone through lots of inspections, and we've not had any problems with it, except for when people didn't put their name and their address on there. They just printed it out and stuck it in a folder, and that's all they did. That didn't work so well. But this will give you the skeleton of a plan, and you'll have to fill it in. What I would do is look at every single policy. There's stuff about evacuation plans in there. Obviously, that template doesn't know how you want to evacuate your building. So you want to look at some of the policies pretty closely and make them yours. But it does give you sort of the skeleton to put that together for you. But great question. Okay, maybe any others, or let's see here. Do we have anybody with their hands raised for questions? Anybody awake out there? Oh, Joanne's got nope, and now she's got her hand down. All right, Joanne. Do we have any more? We'll give everybody a couple more minutes. And so I see Kathy has a question. Do we have another question, Dani?
I do not see one.
I see Kathy. Oh, I hear Savannah. Um, let's see here. Oh, Kathy was the one to ask about the certification. And then Pamela asked about us cutting out. And then Kelly. And okay, that's all of them. All right. Well, thank you all very much for your attention. Do remember we are having the seminars. If you have not signed up, please sign up. Big thank you to Azalea Health and a big thank you to ChartSpan for paying for a lot of this for us. And we are going to close out the webinar now. And we will see you guys very soon. Thank you.